Good morning. Good morning, Wakefield, and welcome to our probably seventh or eighth or fifth or sixth meeting of our Friday morning COVID discussion group. We do thank you all for joining us. We hope you all weathered the storm. Yes, boy, if we didn't have enough trouble, we have more snow to date in this winter than we had all of last winter. So something to think about. So be patient. We are actually down a few contractors and down a few of our own personnel, so it might take a little longer to get to some of the side streets and some of the parking lots. But thank you, Wakefield, for cooperating with us. Can you put the map up, Ryan, if you don't mind? Okay, unfortunately, and you'll see from this map, over half of the cities and towns in Massachusetts are now currently in the red zone. Um, I was going to say, and I will say it anyway, not to make light of this, but I never thought that Massachusetts would turn into a red state. Just kind of take that a little bit, get a little levity this morning. But here we have it. And depending how you look at it, this is not because of any one super spreader event or a big event that happened. This is a combination and an accumulation of little parties here and there, I think, Thanksgiving, and people really letting their guard down. And I guess we can't preach this and can't say this enough. See this, but I'm holding my mask up right now. One of these is going to help everybody. And I think another misconception out there is that, because I got tested, all right, for COVID-19, I got tested and my test is negative. Great. A lot of public, and you should get tested, but that doesn't mean that you're tested and you tested negative, that you can now go willy-nilly everywhere and engage with people and do whatever you want to do. Because for that moment, yes, you were not testing positive. Maybe that's a better way to look at it. Who knows what's going to happen a day from now, 2 days from now? Who knows about the other people if you're still carrying or what have you? So just because you got tested negative, great thing, right? I got tested negative, but still, it doesn't give you a get out of jail free card, so to speak. So let's keep that in mind. For Wakefield, I'm happy that we had last 2 weeks over 4,000 people got tested, which is a good number. We were averaging around 1,500 a week. We ended up averaging 2,000, and part and parcel was the 700 or so that came to our site last Saturday at the vocational school. Excuse me, last Sunday. I will tell you that that is available this weekend from on Saturday and Sunday. And please, please pre-register. You can do that very easily online with a couple of clicks and put in your information. It makes the line go much quicker and much smoother. And then you kind of know when to show up. And if you show up around that time, it's much better than sitting in line with a bunch of other people. So Wakefield is still red, a positivity rate of 6.12%, trending higher. And unfortunately, we have a lot of company. All of our neighbors, Reading, North Reading, which were in the yellow for the last couple of weeks, they're also have turned red. So I think we have to continue to be vigilant. I know it's hard. I know that the holidays are going to be hard. Some of us that have elderly parents, anybody who's on, don't tell my parents I said they were elderly, but they are. They've got to be, it's being careful for them and what have you. So that's the wonderful good news that I had to say to share with everybody. I'm going to turn it over to Ruth for some words of wisdom, who's standing, I think, in the next. Go ahead, Ruth.
Thanks, Steve. So the testing that we did last weekend went very, very smoothly. Want to thank the Voc for letting us use that site because it really is a perfect site for that. And we had it's 732 people come last week. And that included 20 school department employees and 10 town employees and the rest all Wakefield residents. So again, just a reminder, it is for Wakefield residents only, unless you work for the school, the town, or the light department. So bring your ID because we do check IDs. And again, we are doing it again this weekend, 9 to 5. And yes, it's going to be cold. So if you want to bring hot chocolate for the people who are working out there, I'm sure they would love it. Anyway, so we also have actually some other good news. It's so rare right now I get to talk about positive things, but the good news is, well, actually 2 parts of good news. The first part is, as I think a lot of people know, Melrose Wakefield Hospital has already started vaccinating their staff, starting with their patient-facing staff, and they'll continue to do that until they get through everybody. So they've started, which is fantastic, and it means the process that we've been waiting for so long has started. And the other part of the good news is we'll be vaccinating fire and police the beginning of January through the health department. So we'll actually start to have some local people starting to be vaccinated also. And if people want to see where they fit on the list of where they would be eligible to be vaccinated, if they go onto the state website under the and put in COVID-19 vaccination plan, there's a chart with 4 phases, phase 1, 2, 3, and 4, and then there's a list within each phase. That list is in order of priority. So not only are the phases a priority, but the list of groups within that list is also priority. So you will see that the very, very first priority was healthcare workers and long-term care who are also being vaccinated. The next one on phase 1 is public safety, which will start beginning of January, as I said. And so the public is welcome to look. They're going to be, I was on a call this morning where they talked about they'll be clarifying some of those categories for people. So it's a little bit more specific. So if you have a question, are you an essential worker, which then I don't think they're using that term anymore, or which category would you fit in? And it's not clear to you now, keep checking because they're going to keep refining that list and making it clearer for everybody. So it's very positive news where it does not mean that we can let up with our precautions. It's going to take a long time to get everybody vaccinated. And even when you're vaccinated, because it's 2 vaccinations and we'll be using, at this point, we're using the Moderna vaccine. Between getting the 2 vaccinations and having it kick in, you're talking about 6 weeks from the first time you get your first shot to the time that your full antibodies are up to snuff. So again, we cannot let our guard down. We need to keep staying away from each other. And that's just the easiest way to say is everybody should be keeping their distance from everybody else and be wearing their mask. And I know you're tired of hearing it, but I'm going to keep saying it.
Thank you, Ruth. Doug?
Thank you very much. Good morning, everybody. I'd like to start off by, thanking Ruth and Tom and Steve for being the architect behind the testing that happened last Sunday. And just again, a reminder to all of our Wakefield Public School employees that testing will be happening again this Saturday and Sunday. So if you're interested in getting yourself tested, I think it's a great opportunity. I think the lines moved really quickly, especially when compared to some of our local testing sites. And so I think it's a really great opportunity to get in and get out and get tested pretty well and pretty quickly. Results also were returned, I heard, Ruth, within 24 hours.
Actually, people got their results early Monday morning. So not even well less than 24 hours.
Yep. So that's actually a great turnaround and much faster than I think a lot of other places are right now. So COVID numbers in schools this week. So we're up. All numbers are up outside of our schools, but in schools we have 15 new student cases and 2 new staff cases. Our numbers have been hovering around between 8 and 10 in the last couple of weeks. This week we're up in regard to positive cases We continue with the support of the Board of Health to be able to contact trace in school. Our bigger challenge and our greater concern right now is the rate of change and the number of both students and staff that are needing to quarantine because they've been exposed or have become a close contact. And so our numbers right now at the student level are 135 students. And that number's up about 35 or 40% from last week. And our staff number is at, I think, between 16 and 18 right now. I think it's going to be 18 to 20 by the end of the day. But that number has almost tripled compared to last week. And so, and as our staff increasingly need to quarantine, it affects our ability to staff classrooms. It affects our ability to staff programs and to support students, right? And as other faculty whose primary responsibility might be to support a class, we're now pulling people to backfill for teacher absences and for other duties that need to be done. So it's increasingly becoming a little like a Sudoku problem where staffing and supporting and teaching students has become a real issue for us at the elementary level, the middle level, and the high school level. Next week, so because of that, when we send out our letter today, in the middle of our letter, you will see some bold print that will state, due to our number and the rate of change in regard to the number of students and staff that are in quarantine, we are scaling back, excuse me, we're scaling back the elementary, preschool, and middle school schedules. Our high school will be remote next week, but we will be scaling back pre-K through 8 to also go remote for next week. And that's Monday, Tuesday, and the half day Wednesday. So the principals will be reaching out with updates on schedules for remote schedules for Monday, Tuesday, and Wednesday. And that information will be forthcoming probably by midday today. And if anyone has any questions, of course, you're more than welcome to reach out and get in touch with my office, and we'll be happy to have a conversation. With the exception of that, that's the very quick update from schools.
Okay, Tom, can you give us an update on emergency management? There you go.
Sure. Mr. Mayo had saw that we had a rise in numbers and we went to red. He decided to cut back the hours at Town Hall, which were open 5 days a week, but it's 8:30 to 12:30. But people are still manning the phones, email system. We have the boxes out front, so you can still conduct your business, 24/7 really, if you need to get things done. And that's for the protection of both the public and our town employees, which we have to do. As far as the testing that we've been running, the good news was that the positivity rate on that was only 3.6, and the state average the last 7 days was over 6. So that was another good thing for our town. So far, for the sign up for the Saturday and Sunday, we have 694 people signed up for Saturday, and we have 639 people already signed up for Sunday. So we're going to have some pretty good numbers, and I believe there's still a pretty good portion of people who don't either have access to the computer or are just going to show up. So it's going to be pretty successful. And kudos to Ruth and her team, along with Cataldo Ambulance, for the job that they're doing. The other thing I do want to mention is that, and I've said it before, the CDC guidelines are important. Wear the mask, watch your distance, wash your hands. But the two major things really that the CDC just came out a couple of weeks ago is saying, please do not travel. And when you celebrate your holidays, do it to people in your house. And there's no coincidence between the rise in numbers that we had in this state and the rise in numbers we had across this country, primarily dealt with Thanksgiving. So if we can cut back these numbers, it's only going to help us. So please, if you can do that, that'd be great. The one last good thing is that I'm now working on a project to buy us the town a freezer for storage for a vaccine. So things are looking up, but please just be diligent in taking care of business. That's all I have.
Great. I would agree. Great job by Ruth and her team and Tom on the testing, and town employees that volunteered their time that aren't necessarily in the Board of Health or working in the health department, that were checking people in, moved quite quickly, quite well. And please extend to Cataldo. Those people were very pleasant. I had a lot of people say, boy, wasn't it nice going through, and people were very pleasant doing the testing, and it kind of made for a nicer experience. So those numbers are great, that almost 700 each day, which means, again, it is important that you sign in for a time and that you show up around that time. We don't want to have, traffic all over Farm Street. Other than that, we really got to be strong. I do agree, keep your circles small. I know it's not easy. But we've worked too hard to affect too many lives and to have a positive effect on everybody. We're here in the fourth quarter. Let's finish strong. Does anybody have anything else? Jen, anything that I missed?
I will say I went through as a participant last week. It was really easy, and the Cataldo folks were incredibly polite. It moved right along. I anticipated way on Farm Street, my car, not the case. So kudos to all of you who managed that. The only thing I wanted to add is not necessarily COVID related, but I wanted to do a quick plug for anybody who's not signed up for the Code Red e-alert system. We used it this week to communicate about the parking ban and the trash delay. And I have seen a lot of chatter on social media asking, does anybody know why my trash wasn't picked up? Sign up, create a managed account. I put the link in the chat here. If you're watching a recorded version, if you go to wakefield.ma.us, click Get Town News in the upper right-hand corner, and there's a link there to do Code Red. Create a managed account. That way, if you happen to move, you can remove yourself from the list. I know some communities use it every week to communicate things. We try not to abuse it. It's really just for emergency type communication. So,
Excellent point. Unless anybody has anything else to add, I see no's. I want to wish everybody a very, very happy and healthy holiday over this next week. We will most likely not have any updates until after the new year, with next Friday being Christmas Day and the Friday after that being New Year's Day. However, if something does happen that we do need to address everybody, we will certainly do that. So my wish is that you all stay safe, stay healthy, and have a wonderful holiday, quiet and in a very small circle, just people in your household. Take care, Wakefield. Have a great day. Bye.